we're getting all that stuff is relatively clean data. Why weren't we able to do stuff with that quickly?
Well, it may be clean data, but the data wasn't shared. So if you don't share data amongst the hospitals, then you're not necessarily going to have information and knowledge from that data. So we need, very badly, we need an international consortium of hospitals to pool their data so that when the next pandemic hits, then we're going to be much faster at coming up with insights about therapy. And this goes to this goes to medical therapy with remdesivir and all the other agents, antibody agents, so that you really need to pool the patient experience so that the next patient will truly benefit from the cumulative knowledge that you built from the prior patients.
Yeah, and we're, from a public health standpoint, that data and that data architecture is almost not even at the starting gate for AI at this point.
Yeah, particularly in the US, we should be embarrassed how bad our public health infrastructure is. As you have a global health background, and it's just astounding to me how a few second, third world countries probably arguably have as good, if not better, public health infrastructure as we have. Now, we have great expertise in global health and virology and epidemiology, but when you don't have the infrastructure, just like you can have a great AI expert, but without the data and infrastructure, you still are disadvantaged. So I think one of the things I've said is having good public health strategy coupled with good AI strategy is like having protective gear as well as weapons when you fight a war. In this case, it's the virus. So you kind of have to have both, right? You have to have both good public health and data and IT infrastructure with great AI technology, and that would be a very synergistic dyad.